What's up everyone? Hi, how are you? Long time no see. Welcome back to Rally Pharma. If you're new here, hi, my name is Linda, a trained pharmacist by profession, and we're continuing with our series of careers in pharmacy. And before we even proceed, just kindly take 5 seconds to subscribe to World's Best Doctors channel. Thank you so much. So with me I have a guest today, and guys, you know how we welcome our guests here, so let's give him our drum rolls. Let's go. Thank you. So welcome, Daktari. Kindly introduce yourself to my audience.
Thank you very much, Dr. Linda. It's a pleasure to be here. My name's Dr. Francis Muhindi, and I'm currently working with Children Pharma as a warehouse manager.
Okay, so he's already jumped and introduced the topic of the day. So we're going to talk about careers in pharmacy, a warehouse manager as a career in pharmacy. So without further ado, Dr. Francis, kindly tell us what a warehouse manager is. Like, who is a warehouse manager?
Okay, it's really broad, but I'll just narrow it down to a pharmaceutical point of view. A warehouse manager is one who takes control of the warehouse. To be precise, but there are roles which are to be played over there. So you make sure that you do check first the arrangement of how your warehouse is supposed to be. You should be well aware of how to receive, and after receiving you should be aware on how you are going to place them, and these are to be done either alphabetically or pharmacologically. It all depends with how you want to arrange it. And stock taking, you have something which is called stock taking, so you make sure that whatever you are receiving is as per the packing list that you have, because you normally receive, for us where we store mostly imported drugs, we do receive them outside Kenya, so there is a packing list that you have to check on it. Yeah, and many more things. Okay, so you jumped straight into the roles and responsibilities before I ask the question, but I'd just like now you to expound on the roles and responsibilities. So you mentioned about receiving of pharmaceuticals. Yes.
So are there any quality checks that are usually done, or how is receiving of medicines done in a pharmaceutical company?
Yes, with that you have first, the first thing to check is the receiving documents, whereby you have to make sure that whatever you're receiving is meant to come to your warehouse, especially where so many warehouses are, and you may have 2 or 3 pharmaceutical companies receiving. You would be receiving medicine that is not meant for you. So you confirm that these are the documents which are supposed to be for our company. For example, the track details, you have to know that it's going to be received at this particular point of time. We have the importation papers. Once that one is done, and it is well tallying with what you already have, you also check on the track cleanliness and whether the mode of transportation was quite okay, because some medicines have to be kept at a certain temperature. If they have exceeded the temperature that is conducive for the medicine, it would have affected the quality of the medicine. So if it has, by any chance, you have to call a pharmacist, or being a pharmacist, you work both together and see what can be done. Secondly, once the track is clean and everything is good, you also check the condition of the medicine. Some come when they are completely humid, they are not in a very good condition. So once everything is done, then you start receiving the medicine and you start arranging them as per the packing list provided.
Okay, now thank you for taking us through the receiving procedure. Now let us go to the storage of medicines.
Yes.
So we know that medicines are they're classified as time and temperature sensitive.
Yes.
So can you tell us some aspects of good storage practices for the medicines? Because you see that, for example, if you are to arrange them on pallets or whatever, just give us now a broad example of how we are supposed to store medicines in our warehouse so that we don't interfere with their quality, safety, and efficacy.
Okay. First of all, while receiving, it is not advisable to place the medicines on the floor. They must be kept on a pallet and onto their respective racks. This is to prevent contamination, because the floor is always mainly contaminated. Secondly, if you have a big warehouse and if the warehouse manager is working with the pharmacist, there's something called temperature mapping. So once you've done temperature mapping within the warehouse, you would clearly know that this area the normal temperatures go beyond this to this, and this will help you on your storage capabilities. You will know that if I store this particular medicine at this particular area, temperatures do not exceed 25 or 30, and that will be very conducive for this particular drug. At the same time, those that can go like their temperature range goes beyond that, and you know specifically where to place them, with the temperature mapping, it helps you to arrange on accordingly the way you want it to be.
Okay, now different types of storage areas in the warehouse.
Yes.
Yeah, like for example, quarantine, damages. Could you just like mention the broad types of maybe storage areas in a warehouse? Because you see, there's a systematic way in which you're supposed to arrange drugs. Like you cannot mix expiries with damages. So
yes.
Could you just kindly tell us like a broad classification of maybe some areas in the warehouse?
Okay, so we do have the general storage area. This is where you place your medicines which are to be sold, which are actually quantified, and these have to be paid. And we do have an FOC side. FOC is free of cost. Some of our customers get a free sample or an extra, like if you buy 10, we'll add you 2, we'll add you 3. So those are kept at the FOC side, which is totally different from the sellable stock. And apart from that, we do have a specific designated area where we'll have a quarantine area, which we will place medicines which are expired, those that came destroyed during receiving, because some come completely dismantled. Injectables could be broken, and you know, once a glass is broken, you can't use that on clients. Some may be rejected by a certain client due to pharmacological effect. So those type of issues, or those type of medicines that have that particular issue, are stored at the quarantine area. We do have expired, which is also on the side of quarantine area, and it's always under lock so that nobody can access the expired one, as well as the ones that are broken. We also have samples which are used for PPB registration of medicines. Those are also stored at the quarantine area because they are not yet registered, so it will be illegal for them to circulate. So they are kept there until registration process is done, and once that is done, then they can be brought into the market.
Okay, so thank you so much. Yeah, so thank you so much for actually taking me through your roles and responsibilities at large.
Yes.
Now let us look at now how someone becomes a warehouse manager. Like, how did you actually become a warehouse manager? Did you do any trainings, or just tell me about the credentials?
Okay, for those who are not in a pharmaceutical field, there might be a little bit of training for you to understand, because what you're dealing with is not the normal things which, for example, let's say it's storage, for normal storage things, let's say metals or something. Those ones don't have a specific serious routine of storage. But with pharmaceutical products, there are so many things to look at. You have to look at the cleanliness, you have to look at the nature of medicine, whether it is a tablet, is an injectable, whether it is a liquid. So being a pharmacist, it was easy for me to just blend in, because understanding what you're dealing with and the nature of the particular drugs, it will help you on how to store them. So yes, it depends whether you're a pharmacist or not. But if you're a pharmacist, it becomes so easy. You just blend in, because so many things that are there are quite normal, because that is what you went through during your study period. And for non-pharmacological people, maybe
you need some training.
Yes, you actually do.
Okay, so being a pharmacist will just actually be able to open many doors for you, as you have seen. So let us look at now challenges in your work. Like, do you face challenges? And if yes, if you do face challenges, I know that they are, just kindly tell us about them and how you go about them.
Challenges are many. I don't know if I may be able to list them all, but yeah, there are a few which I may want to. You see, having that pharmaceutical background helps you to understand on the nature of the med and how you want it to be stored. And if you have people who have not been in the same field or are not in the same field, you tend to forget that they don't know these particular things, and you assume they know. So once you come into the storage area and discover that a box has been placed down, or medicine has been kept upside down, especially with syrups, and this may interfere with the syrup, the quality of the syrup. And as on another note, during receiving, those that bring the medicines are just normal drivers. Their job is to transport, and they don't really know that there is a special way of handling these particular things. So trying to explain it to them that this must have come like this, temperature should have been to this, it's something totally confusing to them. And also while receiving, because you're receiving a 40-feet container, you can't actually receive it yourself as a warehouse manager, so you actually get help from outside to help you offload. And many people don't know that these are highly sensitive material, so their way of handling may damage the medicine. They may mishandle it. So other than that, I mean, there are so many, but those are the ones I could remember right now.
So last questions as we come to the end of the video. So first of all, do you really like your job?
Oh yes I do. I enjoy my job. Because this is okay, what normally people really think pharmacists do is just dispensing, and maybe if they are so much advanced is going to manufacturing. They don't know that we do have these other branches that actually are there to help you explore more than just understanding what the medicine is. So yes, being a warehouse manager, it helps you understand how you actually have to store the medicine. It also helps you to understand on how logistics are done on a transportation basis, and it also gives you a clear understanding of which area uses a certain medicine and as to why. Like mainly the western region of Kenya and the coast, they are highly affected by malaria because of the water. So that those are the many places we know that this is what we have to supply.
Okay, so lastly, any parting shot to any pharmacist who wants to join this field? What can you encourage them?
I would encourage as many as they can be to actually join, because they would really have a very good exposure, especially on storage purposes. For example, there are some medicines which have to be stored under refrigeration. So that is so those that are stored under refrigeration conditions give you an understanding. Okay, it actually makes you understand, like, why would you store this under this particular condition. So it actually it makes you understand the pharmacological part and the storage part. Secondly, it's another profession that has not been actually explored by many pharmacies, because we are more into pharmacy, more into logistics, more into pharmacovigilance, and this is another field that is actually quite interesting, not really explored. So please, try. It's something you will enjoy.
The opportunities. So lastly, thank you so much, Doc, for actually coming to just take and participate in this series. I really appreciate it. And lastly, guys, you know how we do it. Thank you so much. Please, if you like this video, give it a thumbs up, and please, just another 5 seconds, hit that subscribe button, and just hit the notification bell so that you can be notified anytime that I post. So thank you so much, guys, and I'll see you on my next video. Bye bye.
Thank you.